So today we will be talking about the adrenergic drugs classification, and this will be the adrenergic drugs part 3 of our lecture. And I have already uploaded uh, part 1 and part 2 of this adrenergic drugs wherein the alpha and beta actions of adrenergic receptors are mentioned. So I recommend you to go through those videos so that it will be easier to understand the usage, mechanism of actions and adverse effect of these adrenergic drugs that we will be talking in part 4, and this classification will be part 3 of adrenergic drug classification. So let's start. Now adrenergic drugs classification, it has two two classification two classification. One on the basis of the mechanism of action, and another is the on the basis of the use or its action. So let's start from from first classification, that is on the basis of adrenergic drugs. Adrenergic drugs classification. Adrenergic drug classification. First, let's classify on the basis of the mechanism of action. This will be classified as direct, direct adrenergic drugs, or you can write it as directly acting adrenergic drugs. Next will be indirectly acting, or simply let's write indirect acting adrenergic drugs. And next will be, third one will be our, due to less space I will extend this below, that is third one will be mixed acting adrenergic drugs. Mixed acting adrenergic drugs. So why we call it as directly acting or indirectly acting or mixed acting? Let's see. This directly acting adrenergic drug means we know the neurotransmitter at postganglionic sympathetic fibers is noradrenaline, chiefly this noradrenaline, and we also know that when sympathetic nervous system gets activated, the adrenal medulla releases both adrenaline as well as noradrenaline, and this goes to the circulation, general circulation, and through the general circulation, this adrenaline as well as noradrenaline act on all cells and tissue that should be activated during sympathetic nervous system. So we also here include adrenaline as neurotransmitter of postganglionic sympathetic fiber. However, this if examiner asks what is the postganglionic sympathetic fiber, postganglionic sympathetic fiber neurotransmitter, your answer will be noradrenaline, but this also does same action like noradrenaline, and some difference action also we will see in other lecture. That so what I am here want to explain, what I am going to explain here is that this directly acting adrenergic drug means these drugs act on the adrenergic receptors, that is alpha and beta receptors, and mimic the same action as that of this noradrenaline and adrenaline. So, the examples will be like itself noradrenaline and adrenaline themselves will be the examples also here, because these also act either endogenously given or exogenously given. These also act on the adrenergic receptors and mimic the sympathetic functions. So we also, since these drugs mimic the sympathetic functions, we also call it as or sympathomimetic drugs. Noradrenaline, 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 adrenaline, adrenaline, phenylephrine, phenylephrine, salbutamol, salbutamol, terbutaline, terbutaline, etc. There are many other examples also that directly act on the adrenergic receptors. Then what is the then which drugs are known as indirectly acting adrenergic drugs? Then these drugs will be drugs that potentiate the action of this noradrenaline and adrenaline that is released endogenously, that is released endogenously from the nerve terminals, nerve fibers, postganglionic nerve fibers of the sympathetic nervous system. Then what they will do? They will enhance the release of, what will be the mechanism of action? Enhance the release of this noradrenaline and adrenaline. Mechanism of action will be enhance the release of noradrenaline and adrenaline and mimic the sympathetic functions via this pathway. Enhance the release of noradrenaline and adrenaline and mimic the functions of sympathetic nervous system. But these drugs have no action on adrenergic receptor, no direct action on adrenergic receptors, so called as indirectly acting adrenergic drugs. Then what will be the examples? Here examples will be for example mephentermine, ephedrine, etc. And then what will be the examples of these mixed acting adrenergic drugs? Why called mixed acting? Because these drugs can have direct action on adrenergic receptors, or these drugs also enhance the release of this noradrenaline and adrenaline and mimic the sympathetic functions, so called as mixed acting adrenergic drugs. What will be the example then? Like amphetamine and its congeners like dextroamphetamine, methamphetamine, tyramine, tyramine, and some other drugs are also mixed acting adrenergic drugs. So, this is our classification of adrenergic drugs on the basis of mechanism of action. On the basis of mechanism of action, these drugs act directly on the adrenergic receptors and mimic the sympathetic functions, so called as directly acting adrenergic drugs. These drugs, these drugs do not have these drugs do not have any direct action on the adrenergic receptors, but enhance the release of noradrenaline and adrenaline and then mimic the sympathetic functions. For example, this and these mixed acting drugs were called so because these have properties of both directly acting adrenergic drugs as well as indirectly acting adrenergic drugs. So, this is our adrenergic drug classification on the basis of mechanism of action. On the basis of mechanism of action. Mechanism of action. So, this classification, from this classification you will be asked mainly MCQ and Viva. For long question, next classification, what we are going to learn hereafter, that will be asked in long question in your uni examination or pre-uni examination or any internal examinations. So, let us see another classification. Next classification will be on the basis of function action, and on the basis of function action or use. All these terms you can use. So, what will be the next classification? On the basis of function action or usage. For example, let us see here. I am writing now with numbering. For example, pressure agent. Name suggests it is used in hypotension or cardiac arrest, that will elevate the pressure, and some other uses also. What will be the examples? For example, ephedrine, noradrenaline, phenylephrine, dopamine, and methoxamine, mephentermine. These are examples of pressure agent. What is next? cardiac stimulants. What will be the examples? Examples will be cardiac stimulant, adrenaline, dobutamine, and isoprenaline. This also known as isoproterenol. Isoproterenol. So these two category remember as we have a short mnemonics for this pressure agent. Remember a sentence with pain with pain you can do PhD or make meme. So from this sentence underline this pain, PhD and meme. So this P for pressure agent, E for ephedrine, N for noradrenaline, again PH for phenylephrine, D for dobutamine, ME for methoxamine and another ME for mephentermine. Remember this mnemonics. And here also remember mnemonics simple. CARD, remember as CARD. This C will stand for cardiac stimulant, A for adrenaline, D for dobutamine and I for isoprenaline. So remember in this way, or you can make your own mnemonics and remember these drugs. Then what will be the next classification type? For example, bronchodilators. What will it do? It dilates the bronchioles and will be effective in reversible airways blockage like COPD, uh, COPD and bronchial asthma. COPD means chronic obstructive pulmonary disease. You know it well. Examples will be bronchodilators. Examples will be remember at triple sugar iron agar. You might have studied this and this border security force, but here will be its different meaning. T stand for turbotalin. Turbotalin. S stand for salbutamol. Salbutamol. I will stand for isoprenaline. B for bam butorol. As for salmeterol, salmeterol and F will stand for formoterol, formoterol. So remember it as TSI BSF, People's over Iron Agar Border Security Force, but here the meaning of or full form of this will be these drugs. Now let's move on another types. Number 4 will be uterine relaxants. As the name implies, this will be used in when uterine relaxation is needed. That is when uh, abortion is when when abortion is to be prevent, spontaneous abortion and other threatened abortion to prevent threatened abortions, these drugs will be used. What will be the examples? Example will be also remember this fact. Let's suppose one of your friends name is Rista and you call her as Ristu. So remember at Ristu. What this means? U for uterine relaxants, R stand for Ritu Dream, I for isoprenalin, isoprenalin. You this as for salbutamol, salbutamol. This T will stand for terbutalin, terbutalin, terbutalin. Sorry, this as will stand for isoxsuprine, isoxsuprine. Remember at reach 2. Then move to the another examples on the types. 5 C4 CNS, central nervous system stimulants, CNS stimulants. For this you have been hearing from plus 2 from your plus 2 that amphetamine and its congeners stimulates the CNS, and some drug abusers use these drugs or addicted to these drugs. So what will be the examples? Amphetamine, amphetamine and its congeners, for example dextroamphetamine, methamphetamine, then methyl methylphenidate, amphetamine and its congener. At least remember it in amphetamine dextro or meth. On those examples, number 6 will be anorectics. 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 Remember it at SAF. You must have heard SAF championship games. So remember it as SAF. What will be its meaning? As for Sibu Tra mean this one A will stand for anorectics, and another A will stand for adrenaline, and F will stand for phenfluramine. Phenfluramine. Move to the other types. Six, 7 will be like nasal decongestant. Nasal decongestants. These drugs will be used in nasal decongestions that is caused by like rhinitis, sinusitis, this inflammation, infection of the upper respiratory tract that causes the inflammation of this respiratory tract and hinder the normal respiration. So these drugs will reduce the inflammation there in upper respiratory tract. So then what will be the examples? Examples will be xylometazoline, xylometazoline, oxymetazoline, nafazoline, nafazoline, like pseudoephedrine, 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 and some other examples also. So these are the examples of nasal decongestant. So these were classification of adrenergic drugs on the basis of function or action or usage. Hope you enjoyed the lecture. Next lecture will be our part 4 of this adrenergic drugs, wherein we will be discussing about its general effects, adverse effects and usage, and some contraindications also. Thank you for watching.